Sridharan. I'm currently working as an associate professor in oral pathology and microbiology at YMT Hospital. I'm here to provide an overview of the various salivary biomarkers in oral cancer and what is the current trend and what are the possible things that can be done in the future. Part of this work was related to my PhD research, and some of it was a general overview, which we will look through as we go along. Now, what we need to understand, one is oral cancer is one of the most common malignancies encountered in the world, and the incidence of oral cancer is very high in Southeast Asia, especially owing to the use of tobacco as a primary risk factor. Among the various oral cancers that are evident, the oral squamous cell carcinoma constitutes the most common epithelial malignancy, which is multifactorial in etiology. As I mentioned, tobacco is one of the prime pathological factors. And the problem with this is that they have a very poor morbidity and mortality and poor survival rate, even of 5-year survival rate. Most of these oral squamous cell carcinomas may arise de novo, or in many cases, they may arise from pre-existing diseases with a collective as oral potential disorders. These potentially malignant disorders are a group of disorders which has an increased potential for malignant transformation, and they include leukoplakia, erythroplakia, and oral submucous fibrosis, amongst others, of which oral leukoplakia is the commonest. The worldwide incidence is ranging between 0.2 to 11.3% with regard to the development of malignancy from precancerous condition. Now, as you all know, that carcinogenesis is a multi-step process which is characterized by cellular and molecular events, and these events occur as a complex interaction between genetic and environmental risk factors. Of course, the advancement in the recent molecular and genetic techniques have enabled us to know about some of the critical events which are associated with the development of oral cancer and oral precancer. The problem that is faced by most of the clinicians is that the delayed diagnosis and also the inability to accurately predict the malignant transformation, which are the key factors that are associated with the poor prognosis of oral squamous cell carcinoma. The diagnostic and therapeutic advancement has not really contributed to improvement in life expectancy. As I mentioned, that the life expectancy isn't for a 5-year survival. So much of the research right now is primarily focused on an early diagnosis of oral cancer, as well as to improve the prognosis. In addition to it, there are also attempts are being made to evaluate whether we can able to predict the malignant transformation rate of oral potential malignant disorders. So the use of certain biomarkers, which are basically a normal endogenous product that produce in greater concentration in the cancer cells, or some of them which are formed because of newly switched on genes, are necessary to be identified to predict or to associate with the cancer diagnostics. They may be present as intracellular substances in tissues or are sometimes released into the circulating body fluid. So what we try to do is, instead of trying to identify a single molecular marker, it's always prudent that a panel of molecular markers are done together. Hence, you can be able to try to arrive at a specific biomarker which is specific for each tumor.
Sorry, Dr. Gokul, your slide was just, we are able to see the first slide, here, not slide presenting.
Not changing? Now?
So, yeah, it is not changing. Yeah, now it is, now it is changing. Yeah.
Okay.
Fine. Yeah, yes. Better you can just, I suggest you to start the slideshow for the better visibility. Yep.
A slideshow, if I show, you are not able to change it, no?
You can just press on the down arrow. 1 second. No, it is not changing.
Only if I keep it this way, it's changing.
Okay, that is fine. Then you can continue with the same. Yeah. Sorry for the interruption.
Yeah. Okay. For the inconvenience. Yeah. So I just yes. So based on these biomarkers, the recent advancement is related to the identification of molecular targets in the cancer cell, which together have given the combined name of omics technology. The omics basically includes genomics, proteomics, metabolomics, and transcriptomics. I have highlighted metabolomics because much of my research work was dealing with the identification of salivary metabolomics in oral leukoplakia and oral squamous cell carcinoma. So using saliva as a diagnostic tool is based on the fact that there is a very easy method of collection. It's usually non-invasive, and also the close proximity of saliva to the oral lesions makes it an ideal tool for identification of these potential biomarkers. primarily over a period of time, the use of the salivary diagnostic did not find much hold, whether because the concentration of these biomarkers in saliva was very minimal to be detected by the available technologies. So over a period of time, when the technology has advanced and the instrumentation has been advanced, so this identification of salivary biomarkers, even when present in a small concentration. Now, where do these biomarkers come into the saliva, and what are the source of this information? So, most of the DNAs and RNAs present in the saliva are derived from various factors. The salivary DNA represents the genetic information of the hosting human body, also the oral microbiota, the infecting DNA virus. The salivary RNA provides information on the transcription rates of the host gene and also microbiota. The salivary proteins represent the genetic information, and they help to help in translate regulation of body. In addition to these, the other potential biomarkers, but not limited to, include non-organic compounds, cell cycle markers, growth factors, and cell surface markers. We all know that saliva is harbor to various enzymes and various compounds which are normally present in the mouth, and many a time the oral cavity is considered to be the mirror of body's health, and saliva can be considered to be a very important substitute for into an adjuvant for identification of biomarkers. I think in one of the older Mendel had said that although saliva lacks the drama of blood, the sincerity of sweat, it still has an important acts an important role in identification. So the omics that is used could be proteomics, transcriptomics, microbiomics, metabolomics, or also sometimes microRNAs. So what are these targets? I will not go into the details because lots of research has been done with the various targets. I will try to enumerate few of them. What are these targets which have been tried to do in saliva? Although of course having serum analysis, but saliva sometimes can be useful as a very individual parameter for identification of these alterations. So some of the genomic alterations include the loss of heterozygosity, which is a very significant finding that we see with oral precancer and cancer. Many of the cases now are associating a loss of heterozygosity to be an important predictor for malignant transformation, especially when it occurs in the chromosome number 9p, 3p, and 17p. Other factors like promoter hypermethylation of P16, which is a cell cycle inhibitor, tissue inhibitor metalloproteinases, and few other ones. I'm not going to detail which function. Proteins are a wide range of proteins that have been associated, which have been identified in the literature. The salivary interleukin 6, interleukin 8, and TNF alpha, sialic acid, catherine catalase. Other proteins like ED59 and profilin 1 can also be used, have been tried. I'm just trying to highlight the literature findings of all the possible markers that have been evaluated. Transcriptomics includes the various messenger RNA, which is highly upregulated into interleukin 8 and low, depending on the level of RNA, which is a very significant finding recently. MicroRNA 200A and 125A have been associated with uh, oral cancer and have been detected in the saliva. These are other types of microRNAs. Now, microbiomics, although there is no concrete evidence on whether the microbiota of the oral cavity are a causative factor for oral cancer or are they just a casual association seen, it is still necessary to determine that viruses like human papilloma virus, especially 16 and 18, have an association with increased risk of malignant transformation. Play a role, and certain bacteria which are known to be associated with common oral diseases like dental caries and periodontitis have been shown to be associated with oral cancer. Now, why we need to read about the metabolomics, which I would slightly highlight, is because the metabolome is usually the final downstream product in the transcription and translation, and therefore the metabolomics that are the end product seen in the body fluid are those which are very closest to the phenotypic changes that is seen within these cells. So the characteristics of metabolomics are body fluid. It's very minimal sample preparation and a wide range of endogenous and exogenous metabolites which can be identified and analyzed. It's very difficult to pinpoint on one, but then the idea that we can try to evaluate a range of metabolites helps us to maybe later on narrow down to a specific one which may have a significant role in oral cancer. So the metabolomics that we think can be altered, they belong to the altered in protein metabolism, oxidative stress metabolism, metabolism in this pathway, carbohydrate metabolism, and sphingolipid metabolism. This is some of the pathways that I've highlighted. I'm not going to the depth of the which metabolite is seen in which. And as I said, the metabolomics usually are most closest to the phenotypic changes that take place within the cell, whereas genomic DNA takes place more like genotypic changes. Now, the databases that are available to evaluate metabolomics are in the most common one is the human metabolome database, which are around 45,000 metabolites, which have been associated with various human diseases. In addition, most of the they use a database which has around 80 to 90,000 metabolites. Of course, not all of them are related to human diseases, but identification of such a large range of metabolites and using of various factors like bioinformatics, we will probably be able to narrow down to specific metabolites which can later be quantified and characterized, and thereby, make a very classical panel of biomarkers used to diagnose or early diagnosis of cancer, or also to predict the malignant transformation. In addition to these metabolites, we have stem cells. Cancer stem cells are known to be the molecules which are involved with cancer stem cells include CD44, CD133, and aldehyde dehydrogenase. Currently, there is a trial going on in which salivary CD44 levels are being used for early diagnosis of cancer. Cell cycle inhibitor is one of the most important changes that take place in the malignant transformation as well as in cancer development. P21, P27, and sometimes whole exome sequencing is another possibility by which we can try to identify certain specific biomarkers. The current trends that are taking place with salivary biomarker, it's a very fascinating thing to know that the last 20-25 years there has been so much of a technological advancement that the technique that I used to identify, even if you take 1 ml of saliva, 2 ml of saliva, it is possible to prepare the saliva sample in such a way that we're able to get a broad range of biomarkers. So there is an upsurge in the laboratory-based test for detection of salivary biomarkers, which are ready for validation and then clinical studies. Now, because there is an advanced technology, we are able to provide a large pool of biomarkers, and even these can be prepared from very minimal sample and also in very small quantity. Most of the time, the biomarkers present in the blood need not always be reproduced in the saliva and vice versa. Since the saliva is an ultrafiltrate of plasma, it is a plasma biomarker that is seen in saliva. But what is happening now is because the concentration is very less in saliva, many a time we may be failing in our try to identify. Of course, the technology like liquid chromatography, mass spectrometry, or even a nuclear magnetic resonance spectrometry, we have been able to identify a large pool of biomarkers, even when the sample is lesser, and even when the concerned biomarker is found in very small quantities. And the trend that is usually being worked out by many is the use of a salivary biomarker for point of care testing. Point of care testing involves a shared site diagnostic aid, which we utilize as a part of any kind of a bodily fluid and help in identification of a biomarker in a time, and which also plays a very important role in personalized medicine. Many a time, the laboratory diagnostics takes a couple of days to come, and even when they do, it does have its own drawback. So it'd be very easy to utilize a shared site diagnostic aid, especially when you are doing a follow-up and you need to know on a regular basis. And since saliva being non-invasive and also saliva carrying very little chance of contamination and cross-infection, we can always try to utilize this point of care testing or on a regular basis. But of course, there are always going to be certain limitations in the way that we do. What is one of the major drawbacks which I personally have seen and which happens is, despite this many identifications found in the laboratory, we always say so many biomarkers are seen, so many biomarkers are identified. Their clinical application has not reached its ultimate goal. The problem may be there is a bridge between the uh, laboratory diagnostics and clinical application, which is not yet crossed by the scientists and the clinicians alike. So there probably will be there should be a middle path wherein a laboratory has to have a clinical application. So that is one limitation which is happening, because we do spend lots of money in trying to identify a particular biomarker, but if it doesn't reach the patient, if it is in the end stage, then it really may not have its own benefit. Of course, the cost is definitely a factor, but cost can always be considered when you know the test becomes very simple. Lack of standardization with regard to saliva collection, saliva transport, saliva preservation, if you look at metabolomic acid that is being done, uh, some of them have collected saliva in different concentration. Some in the morning, some in the evening. The condition in which the patient is when the saliva is being collected, the preservation of saliva, whether it is -20 or -80, the technology that is being used, whether it is used plain HPLC, whether it is used liquid mass spectrometry or NMR spectroscopy, it is going to have some kind of a variation with regard to what the data that we get. And much of the data are always qualitative in nature. Unless we quantify the nature and parameters, it becomes difficult to try to be specific with which uh, biomarker to look forward to. Because as a clinician, the question arises is, will this biomarker be useful? So as a research scientist, it becomes very difficult to say, yes, this is going to be able to do it. So we have to have a long-term follow-up and we have to use a multiple ways. But if you're able to standardize the laboratory finding and you may probably make a panel of a certain amount of biomarker, we probably can reduce these kind of the next important limitation is usually the lack of disease-specific biomarkers. By this, I mean that whatever biomarker is getting altered in oral cancer can also be seen in other cancers as well. So it becomes very difficult to say that this alteration is only for oral cancer. Of course, every patient will undergo other investigations wherein he will look for the distant metastasis or anything else. But what happens is that overlap of these biomarkers as per disease. So we don't have a specific biomarker, especially for oral cancer. So maybe if you do research in such a way that we're able to identify certain specific biomarkers, even if there is a small pool which is specific for oral cancer or for oral pre-cancer, it will probably help us in a long way in trying to justify the role of salivary biomarker in early diagnosis of oral cancer. So based on this, what do we propose? We have to see to it that the salivary diagnostic is established an independent clinical aid. Previously, there were concerns that the salivary component may not under the biomarker, but it is not really necessary. Many times, saliva can by itself shows certain products which may be exclusively seen only in saliva and may not be seen in blood. So I feel that as of now, we do not really need to compare saliva and serum every time we do analysis, but we can use salivary diagnostic as an independent clinical aid. We need to try to evaluate and analyze the diagnostic, therapeutic, and prognostic utility of the individual salivary biomarkers. Most of the analysis right now are non-targeted analysis, wherein they are just trying to identify whichever is possible. Targeted analysis with as well as use them as a disease identification biomarker needs to be done, and also we need to validate and quantify each of these biomarkers. It's very important. Suppose I'm getting around 15, 16 biomarkers, I will be very happy that I've got 15 biomarkers. But whether each of these biomarkers individually has a role in the specific disease or oral cancer is something which we need to do. So quantification and validation is further required so that it can be used in the clinical setup, which is the really need of our at this stage. Of course, now you can try to use we have lots of bioinformatics, we have lots of data analysis software. So the analysis of a wide range, maybe even in my research, I got more than 8,000 metabolites, but the use of a software will probably help in reducing the filtering the number of biomarkers as per our requirement. So we need to try to do it. And then we also have to see that we use salivary biomarker standalone tool without relying on the initial identification in blood or other bodily fluid. So most of the idea as of now, what and we should try and evaluate salivary biomarkers in two places. One is for early diagnosis of squamous cell carcinoma, and two is whether we can use it as an important predictor for malignant transformation of oral potential disorders. So I just tried to give you an idea of what it could be instead of going in depth. I hope it was helpful to you. I thank the organizers for giving me this opportunity to speak and thank all the speakers for listening to me. Thank you.